These 7 drugs, if given in excess, can kill your patient. Do you know the antidotes so that you can save them? We're going to have a little quiz today. There are 7 of these total. Let's see how many you know. I want you to comment below and tell me how many of these you already knew. All right, opioids. The antidote is naloxone. Now we worry about opioid overdose. The respiratory rate will go low. So you need to be careful of that and give naloxone. Benzos. This is a big one for NCLEX. Benzos antidote is boom. Flumazenil, all right? Flumazenil is the antidote for benzos, all right? Heparin. Now, you don't want your patient to bleed out. If they've had too much heparin, what are you going to give them? Protamine sulfate. All right, protamine sulfate is the antidote for heparin. Let's do acetaminophen. All right, acetaminophen is Tylenol. This one can be liver toxic. It can kill your patient's liver. Do you know what to give them? Acetylcysteine. Now, this one you can remember because it's acete. Okay, iron. Now this is a big one on NCLEX. If a child accidentally eats like a whole bunch of Flintstone vitamins, you remember how good those were? They taste so good. And sometimes kids think that they're candy, and so they'll eat a whole bunch of them. And that is what we worry about, is iron overdose. All right, so if they have too much iron, what are you gonna give? Deferoxamine. Now watch for the FER. Anything with FER typically is iron, like ferrous sulfate, deferoxamine. We check a ferritin level. So FER, that's always going to clue you in. That's iron. All right, next one is methotrexate. Now this is a big, bad, ugly drug. It's got a lot of side effects. So what do we do if they've had too much methotrexate? Leucovorin rescue. So we're going to give leucovorin rescue, which is made out of folic acid. All right, last one is beta blockers. We worry about beta blockers because if they've had too many, their heart rate's going to go too low and their blood pressure is going to go too low. So what do we give them if they've had too much beta blocker, or LOLs? All right, we're going to give them glucagon. All right, so let me know how many of these that you knew. Write down in the comments what your score is, and we'll see who scored the best and who saved their patient. Bye-bye.